We have the panel with us, that is the care management best practices for improving patient care, engagement, and experience for better outcomes. Today, we have an eminent panelist with us. We have with us our moderator, Joy Chakraborty. He is COO, PD Hinduja Hospital. Welcome, Joy, sir, for joining us today. Thank you for
Thank you
joining
very
us.
much. Thank you.
We have Devanand KT, CEO, Esther Prime Hospital. Welcome, Mr. Devanand.
Yeah, thanks, Dr. Gopi.
We have with us we have with us Dr. Krishna Murthy, Deputy Medical Superintendent, Trustee Secretary, Chhatrapati Shivaji Subhati Hospital. Thank you so much, Dr. Krishna, for joining us today.
Thank you. Thank you. Thank you.
I think Dr. Sujit will join in a while. There is some technical issues he's facing. So by the time I would request Joy sir to please hand over the session. I just wanted to hand over the session to Joy sir. Please carry on with the moderation, sir. Over to you.
What about Dr. Deepali, Dr. Niraj?
Hello.
What about Dr. Deepali and Dr. Niraj?
I think she is not joining. She's not joining. We have four panelists now, including you. Yeah.
So, good
Dr.
evening to all of you, and I want to thank the organizers of Global India Healthcare Conclave for the second edition and giving me the opportunity to moderate this session on care management best practices for improving patient care, engagement, and experience for better outcomes. So, as we know that not only Indian healthcare, global healthcare is undergoing a major challenging situation to manage this unknown disease. But it is also that pre-COVID scenario also, we have seen a lot of challenges in terms of how do you improve the patient outcomes, how do you keep them engaged, give them a better experience, and all this we have seen has evolved over the last few years. And some of the best practices have come out, whether it is our homegrown Indian experience or it is a international experience. From there, we have learned. Now, today's this session, we have focused on how do you improve this care management and very importantly, some of the practices. So there are three components or windows, I must say. The first is your patient care. The second is engagement. So how do you keep your patients, especially with the advent of chronic diseases, where we see the chronic diseases are keeping a patient's overall life cycle engaged with our hospital. So what we are ideally supposed to do. And finally, experience. So in 90s or beginning of 20th century, we have spoken about patient satisfaction. We have spoken about how do you ensure total quality management, but now things are moving towards an overall patient experience movement. So our session is going to focus on improving all these three components to get an outcome. So today, outcome is very important, not only in Indian context but globally. But this outcome has been used in different geography in different way. It is needless to say to this audience that in some of the Western countries, the reimbursement depends on the outcome measures. In India, we have not reached that far to relate the reimbursement, payment, or tariff related to the outcome measures. But there are several attempts have been made by different agencies, including NABH, and we are focused on better outcomes. We see time to time that in the newspaper and everywhere, the patients are not that highly appreciating, or the image of the healthcare industry is under question. At that time, it becomes very important for us to introspect and assess that why we are undergoing this kind of scenario or situation, what needs to be done in a different way. So we'll be moving around some of these points in next 40-45 minutes. And with this, I will start my one question what I'm going to ask to my panelists. And I'll start with Dr. Devanand KT, CEO, Aster Prime Hospital. That can you tell us some of the best practices that you are following in your organization or have observed at any other organization, whether national or international, which covers or which helps in improving patient care, engagement, and experience and resulting into better outcomes. So over to Mr. Devan.
Yeah, thank you, Mr. Joy. Thanks. It's a very, what do you say, exhaustive question. To answer it in a few words will be very difficult, but I'll make a try. The first thing is that, as you mentioned, now the sort of medicine has been, has been really questioned at many forums. See a lot of campaigns against the whole integrity of how we practice medicine, and there is a lot of insecurity among the patients. So that trust and the faith on the profession or the industry has to be regained. For that, the only thing that we can do is to improve the care and improve the communication. The problem is that there are a lot of opportunities for the patients or the customers to look at, they can go to the Dr. Google at any time and find out facts and figure out their particular disease. But they want to get an outcome out of that, but they come with half-baked information to a doctor and presents it, and they expect the doctor to or the hospital to provide the best care at the most reasonable cost. So that is the thing that we all look for. So care now has become not only the clinical side of it, also the service part of it. So I will be focusing on both the sides. So at Aster, what we do basically is to, we have a strategy that we have been following is to hear from the patients and the employees. So we created a very robust and, constant feedback mechanism with patients from where we get the inputs for our course correction. There'll be a lot of gaps. There'll be a lot of errors. There are a lot of expectations for the customer, which we may not be able to deliver. So we always go back to them and try to collect feedbacks from them so that we can deliver those course corrections. Also, we encourage our staff to raise more incident reports, by which we try to really understand the gaps and mistakes that as an organization we are making, and it is scrutinized at a very very serious level, and the corrective and prevention are recommended. So constantly by doing this with the support of the corporate team that we have, since we are present in countries, and it's a large network of 23 hospitals. We have a huge what do you say, a huge bank of information which is shared between the units. So all these best practices we keep on adding and try to improve the patient services. So if you ask me, one the best practice that we follow is basically to collect from the end user and try to create that course correction from our side. That's on the clinical, but on the service side, we are also trying to consolidate the total patient experience and engagement. Now, all the Aster hospitals will be moving to a called one. This is going to be, already it's launched in many hospitals. It is going to come all the Aster hospitals. The patient journey starts before they reach the hospital now. So for the, even it can be a physical or a teleconsultation, they can use the One Aster app. After which they can actually use it for the route maps. Once they reach the hospital, we are also trying to integrate with an indoor navigation inside the hospital, how to navigate. they reach the hospital, the prescriptions, the investigation, all the results are uploaded in the cloud, and the patient also is able to give a feedback through this app. And once they get the treatment, they can go back home, and we also provide them teleconsultation and Astrad home service. This is a 360-degree support that we are trying to provide to improve the engagement experience of patient in days to come. So, on the care side, especially all the protocols, the SOPs that we have created, are we adhering to that? And upon the feedback given by the patients and the employees. So these are the best practices that we have done. Just to give you a small instance, during the pandemic, it's a small thing that we have done, has made a lot of difference, which has actually delighted the customers and the relatives, which is like these patients are in isolation areas. They do not have any contact with their relatives or family. We have engaged few dedicated manpower to enable video calls, consulting the family as well as the patient with the family. That is done at least 2 times in a day, which makes the patient and the family so happy. Many hospitals were finding it to that. So many hospitals have done it also, but this was a step which was making them more comfortable, and it also plays a vital role in the care because it also helps the patient to have the very positive mindset. So such any such best practices in any unit, any other competitor hospitals, or any other players that we have to imbibe that and implement in our unit. So I mean, to begin with, I'll stop it here, and then when the discussion goes further, I'll add on inputs. Thank you.
Thank you, Mr. Devanand. And in fact, one of the scenarios what you have mentioned about during this COVID, when the patients and relatives are isolated and the communication there is a barrier, there are a lot of challenges most of the hospitals are facing. And just to, for the knowledge of other participants, I want to tell that we have Global Challenge Forum, which is a part of the Netherlands-based government healthcare setup, and they are creating this kind of platforms to share these challenges, and there will be people across the globe who are going to come out with some solution. And this is not the unique challenge what you have faced. Clearly, this is the same challenge for the others too. With this, I move on to Dr. Krishnamurthy. Dr. Krishnamurthy, my same question to you also. That can you share some of the best practices that your organization is following, and what you may be knowing from other organizations which you can share with the audience in terms of some practice which is improving patient care engagement and experience for better outcomes?
Thank you for this question. I believe कि most of the hospitals which are at a given level, after a number of beds that they have, जो भी practices होती हैं वो same सी हो जाती हैं, and there are very few things that one hospital will do over some other thing. It is basically कौन सा patient किस चीज के साथ convince हो जाता है. But yes, some of the main things that we are focusing on is the attitude of the staff. अगर जब पेशेंट आता है उस टाइम पे पेशेंट से अच्छे से बात करी जाए, एंड जस्ट नॉट जस्ट एज अ क्लाइंट और एज वो एज अ फैमिली मेंबर उसको कंसोल किया जाए. सो these things help, especially as compared to other corporate hospitals. The challenge that I face is I am in a teaching setup, तो मेरे को वहां पे भी देखना पड़ता है because a lot of learning staff का जो एटीट्यूड होता है बोलने का, it is very important कि प्रोफेशनल तरीके से बात करना, ये सब. So these are the important things. Other than this, I think कि most of the hospitals are, whatever they're doing is similar in most of the senses, and बहुत ज़्यादा difference नहीं होता. Everyone wants to treat patients in a very good way, and the guidelines are almost similar across all the hospital setups. So I do not think there is a much difference. Obviously, अगर हम detail में जाएंगे तो हर अस्पताल अपने बारे में कुछ ऐसी चीजें बता देगा कि पर्टिकुलर डिपार्टमेंट्स के बारे में कि हमारे यहाँ भाई, जैसे मैं कहूँ कि हम लोग पुअर पेशेंट्स के लिए सिजेरियन सेक्शन करते हैं 1500 रुपए में, complete everything included. So these are things that, but every organization can say something like this. So nothing new over what Devanand sir said. And I think बाकी लोग भी panelists भी agree करेंगे कि most of the hospitals are similar in their outlook towards treating the patients in a good way.
So I understand you come from completely different background and you have a different kind of setup in comparison to the other panelists. But I'll be keen to know from being a teaching hospital, being a teaching facility, if you can share one or two maybe practice what you follow, you have adopted in your own setup.
So मैं आपको एक एग्जांपल से बताऊंगा, बिकॉज अगर मैं लंबा बात करूंगा तो बहुत लंबा होता जाएगा. फॉर एग्जांपल, अगर कोई पेशेंट आता है मेरे अंडर भर्ती होने के लिए, आई हैव दिस प्रिविलेज, इट्स everyone doesn't have this. I have the privilege of working in corporate setups and the teaching hospital and being a doctor and an administrator. So बहुत सारे areas जो होते हैं वो clear हो जाते हैं. I've seen students, उनको बोला जाए अच्छा उस पेशेंट को एग्जामिन करो, एंड वो जाके पेशेंट का बेडशीट नीचे कर देंगे और पेशेंट का टर्न अराउंड. सो द सिंपल थिंग दैट दे हैव टू बी टॉट these things, and this is different, definitely different from the corporate setup. This is definitely what corporate में नहीं हो सकता, टीचिंग में होता है, एंड तभी धीमे धीमे करके स्टूडेंट्स टीच होते हैं, एंड वी make them good doctors. The costing is also an issue. For example, बहुत सारी जगहों पे अभी भी इम्प्लीमेंट नहीं होता कि आपको जेनरिक नेम लिखना है, बट बीइंग अ टीचिंग इंस्टीट्यूट एक बहुत ज्यादा प्रेशर होता है आपके ऊपर. You have to be perfect in everything because the students are learning. So I cannot write Dolo. I will have to write paracetamol, and I will have to ensure that my students do the same. So these are small things that a teaching hospital is different from any other setup.
Absolutely, and you have emphasized one of the very important point what I feel you need to follow, that how do you treat your patients with dignity. It is not the person who is getting admitted in a private hospital and paying good amount of money. They only deserve dignity, but privacy, dignity, and respect. These are the three fundamental pillars which needs to be followed even in any healthcare setup, and I'm very happy to know that you are doing that. So with this,
Absolutely.
I move on to Dr. Sujit Chatterjee, and for the audience, he was not there initially. He is the CEO of Village Mandani Hospital, Mumbai. He has joined us right now. So I'm going to repeat the same question to Dr. Chatterjee. That can you share some of the best practices in terms of again patient care experience and patient engagement in these areas? What you can share with all of us? You need to unmute. You need to unmute.
I think the most important thing is, as you have brought out, is respect and dignity for patient, and it is compassion and caring for the whole person, either in mind, body, and spirit. So therefore, there are two areas there. One is, of course, respect and dignity, and the other is patient safety. Now, as far as respect and dignity is concerned, many of my panelists have said, a lot of things on how you engage with the patient. It's very important to understand that we engage with the patient in a manner that they feel that this is a caregiver. You see, ultimately, you have to give succor. So, therefore, if you wish the patient, I think, our culture somehow or the other inhibits us from wishing anyone and everyone. So therefore, if there is somebody passing by you and my staff wishes them and smiles at them, then in that case, it is a culture which a person feels at ease. Now, suppose somebody was to ask me on the staircase where the laboratory is. It's not good enough for me to just give the directions. It's good enough for me to go take them to the laboratory. I might be delayed in a meeting. That's fine. So is my staff. So therefore, I think these are very important things as far as the culture is concerned, and as far as dignity is concerned. So therefore, I think these things, how you tackle a patient, is extremely important. When the patient goes to the ward, then in that case, the nurse cannot just tell the patient, okay, this is your room. You take them to the room, you explain everything about the room to them. You ensure that they are comfortable, and then you thank them for coming to the hospital, so they're so much more comfortable, and there are the doctors who come in. You're not permitted to enter. You can knock and you can ask the nurse to ask permission of the patient for the doctor to come in. Now, the doctors will address the nurses as nurses and not as sisters. If you address a nurse as a sister in my hospital or brother, the nurse is not duty bound to attend to you. So, therefore, we give them an entity. And when they have this entity, they wear it on their sleeve that I am a nurse. So, with that pride, they enter a patient's room, and it makes an enormous amount of difference. The other thing that I would like to focus on is patient safety. That's another thing that is very, very important as our best practices is patient safety. Safety in all areas, right from the physical environment to the medicines to the medical attention, as well as post-operative care and hospital-borne infection. So I think these are many of the things that we engage in our hospital, and we find that it makes an enormous difference for the patient. The other thing is, as far as the culture is concerned, this morning we had an incident, as somebody mentioned about COVID. We had a patient who had recovered from COVID, but was in his room and did not know his wife had died. And his wife had died in our hospital a month ago. Now, the three daughters wanted to explain this to the father. So we rehearsed with them as what they would talk to the patient. We had a psychologist, we had a psychiatrist, we had the pulmonologist. All of them stand around the patient as one. There was a lot of weeping, there was a lot of sadness, but at the same time, they held each other, and that man knew that he was not alone, though his wife may have left the world, but there were people there to put their arm around his shoulder as and when he required it. So these are some of the best practices that we're trying to follow, and trying to make a very big difference as far as healthcare is concerned in Mumbai. Thank you, Joy.
Thank you, Dr. Chatterjee. And some of these are really and definitely very encouraging and inspiring to hear that what you are practicing in your hospital. And I must say that in this world, in healthcare sector, the patient experience probably began as one of the most important thing in Cleveland Clinic around 10 to 11 years back. And today they lead the process of patient experience, and all over the world have learned from them. And what they say that after admission, they have a system, what exactly Dr. Chatterjee was telling, that what to expect during their stay. Because we assume, we believe, we think, we consider that patients are expected to know everything. But when they come to a hospital, they are not in a proper shape, and then they come across so much of unknown things. So it is very important. And as a result of that, we have introduced a system in our hospital also, that soon after the admission, our customer service staff, they go and tell them what to expect, how to avail, what are the important numbers, kind of things. So they feel little ease. And a very important thing, what most of you are touching upon, the compassionate care. Now, this compassionate care, this is a very commonly, popularly used word. Most of us probably use it very loosely. But if you look at, again, the example of Cleveland Clinic, where they have a proper session, they have a model on effective communication between the provider and the patients and all other stakeholders. Can you imagine? I know what they do. They never allow, if a physician in their hospital is treating a pediatric patient, they never allow them to stand and talk to the kid who is lying down in the bed or maybe sitting, because it looks like somebody who is very senior and talking from the top of the room and giving them direction. So they have taught, when you examine, you bend down a little bit, keep your eyes in the level of the kid's eyes. So that is the kind of communication should happen. So these are some of the good practices and all.
we can keep on talking about it. But I move on to again to Mr. Devanand, and for the audience again, he is from Aster Prime Hospital, and Aster Group has presence globally, and it is a global healthcare conglomerate. So my question to you, when you have a background of hospitals present in multiple geographical location, do you think that standardization of care management across all hospitals in the group is the way forward for better patient care and experience? Do you really follow that? And if you are following that, then how do you standardize it? So over to Mr. Devanand.
Yeah, that's a very good question. Yeah, we are present in 9 countries now, different geography in the Far East. Other than India, we are in 8 other countries with 23 hospitals now. Standardization, as you mentioned, is that in care and services are very much required because there is a high level of advancement in technology happening. Expectation of the customer also has gone very higher, and they also know, they also are aware of what is happening in the healthcare. They also go to different hospitals, they do window shopping, so they have certain expectations as a customer. And when they come to hospital, they have some information about the type of care they are expecting, and the type of care they are, they have seen in other places or experienced. So it becomes very, very important that, if they've gone to some other Astra hospital, they will just immediately compare the service of that Astra hospital with my unit. So obviously we have to standardize. They should say that the Astra hospital provide the same care at all the units. So what we usually do is that, this is usually get integrated at our group chief medical officers level. So she is the one who actually handles and interacts with all the medical directors of all the units. And there are certain specific dashboards created for patient care and patient safety related aspects. On the service levels, we have a different team members working on it. So what happens is that, any unit among these 23 hospitals has adopted certain good practices. It usually gets discussed on a monthly basis at a particular forum. And, the unit which has done this gets an opportunity to present it. So what happens is that the same thing can be applied to other units, probably with a slight change of implementation plan suiting the geography, because what is implemented in UAE may not be cannot be directly applied to Hyderabad or Bangalore. So we make site modification depending on the geography and implement. But then on a conceptual note, we are dealing with humans, as Dr. Chatterjee also is saying. It's compassion and empathy. These are all things which is common among humans anywhere in the world. So, most of these good practices are almost the same. You can invariably apply it in any hospital. So that is something which we do at a group level. I'll just tell you an incident which happened during the pandemic. The UAE team was struggling when the pandemic picked up heavily in the UAE. They were struggling. Basically, we also in India also face the same issue of not having sufficient manpower to handle, especially the critical care. But in UAE, it was all the more difficult because there were licensing issues also, and there was a lack of people. So we were asked, the Astra India units were asked to, upskill and deploy some nurses from the units to UAE for a certain period of time, so they can work and then they can come back to the respective units. So our learning and development team rose to the occasion, and then they trained vigorously, and we could also, get a green channel for licensing through our contacts in the government there, and all these nurses were deployed from different Astra units to UAE to support the team there. After doing this exercise, we realized that there is a dearth. Even in our units, there will be a dearth. In situation continues like this, there will be lack of sufficient manpower, especially nursing and critical care doctors, to handle such pandemics. So this has now become a program in itself. The upskilling of nurses in various critical care or crucial areas has become a program in itself, which is being operated in all the units. It has become a regular activity of upskilling. So the standardization brings in that kind of an advantage where, the learnings that we adopted for a particular region could be applied to all units, and all the nurses in all the units are getting trained now. So that becomes a practice. It becomes a standardized procedure also. And similarly, one of our hospital in the Middle East launched a program called COSMOS for the COVID patients. This was like a package of activity to basically to give the psychological support to the patients. So this was, interaction with the family, one part. Then there were, board games. There were lobby level activities for the people who could have interacted with each other. There were some, celebrations planned for the COVID patients. So these were a few things which was done in some Aster units, which we have replicated in many other Aster units. So standardization on the service level, at the care level, both are equally important. And the launch of we've been planning to launch the teleconsultation for a long time, but what happened was the pandemic really pushed it forward, and now there is a whole level of vertical which has come in, and all the Aster units are pushing for more teleconsultation mode to support the patient group. So the standardization has come in. The pandemic has actually, what do you say? You can say it has fastened the process on many the tele mode of consultation and all. It has really fastened the process. But otherwise, also we've been following the standardization which was practiced in other units, or any good practice, not only in the care, as also in the service levels or any other processes also. Say, for example, a discharge summary delay. We also look at such things where discharge, how can the discharge process can be simplified, and the TAT can be reduced. All those learnings are mutually shared, and we learn from each other, and it has been proven very helpful also.
Very good, very good. Some of the very good examples, I must say, that you are talking about, and I'm happy that it has been implemented or rather adapted in your multiple branches across. And you touched upon the word empathy, and today I must say that this is, in this environment, probably the most important thing. As Dr. Chatterjee was talking about the family, what he has come across today, the way many hospitals will tell that during this tough time because of pandemic, the way people are stressed out, probably this empathy, I'll not use the word sympathy, is going to be the most important thing. And again, some of the Western world hospitals are few steps ahead of us in this aspect. And if you go to some of them, you will see that they use story of empathy, the real life story of some of the patients, some of the caregivers, and they train their healthcare providers, their employees, that how do you show and demonstrate the feature of empathy when you work with them. So that is one bit of it. And secondly, in terms of giving training, I'm happy to share, we have started after realizing that it is not only the patient and relative, your most important resource, your own healthcare staff. And those staff, they are also under very much stress. So we have introduced something called Sampark in our Hinduja hospital, where a 360-degree coverage was given for the mental and social, and in all aspects, the kind of support what management can give to our staff. And that has shown a very positive results in terms of their behavior, in terms of how they are going back to the patients. Earlier, the way they had some apprehension, they have come out from there and they are trying to give their best to them. So thank you very much for sharing those. Now I move on to Dr. Krishnamurthy. And as you come from a teaching medical college, so I'm sure, as you have told already, it is very difficult for you to have some sorts of model to ensure the patient engagement. But can you share that in a large hospital setup like yours, when you cater underprivileged patients, how do you ensure patient engagement and try to give patient experience within the boundaries of what you can give?
Let me simplify this question and ताकि सबको समझ में आए. I think we can focus on basically underprivileged patients. यहाँ पे काफी सारे होते हैं, तो उनके साथ what are the issues that we dealing with, and we can automatically understand what we have to do. For example, let me quote an example. जैसे कि gallbladder operation है, the cost of a gallbladder operation, laparoscopic operation in the city would be something like 30-35,000 in this area. An average hospital, we can have on the higher side and the lower side.
I think Dr. Krishnamurthy is not audible. Can anyone of you hear him?
No, I can't hear him.
I
No,
think he has
no.
got frozen.
His video also is
Yeah, yeah,
now
he has
like
got frozen, I see. So we'll come back to him, but we'll move on to then to Dr. Chatterjee. And so, as a CEO of a hospital in a city like Mumbai, where there are several renowned primary tertiary care hospital we have, can you tell us that what differently LH Viranandani Hospital is doing in terms of the care management process? If you can talk something from clinical perspective that differentiate your hospital from the others.
The one thing that I really believe in is that no patient will be admitted to the hospital until and unless they're seen by a consultant. So therefore, in the emergency department, you cannot have a person getting admitted without consultant seeing. Now, whether it is a crisis or whether it is a routine management, the doctor or the consultant has to have seen the patient. Otherwise, the patient will not be admitted. So, therefore, that is one major safety area that we've been able to establish. Um, and the patient is also extremely happy. Now, there are instances where patients come and say that, look, I am getting admitted under so and so doctor. Now, we have a rota system, and the person says, while you will be admitted under that doctor, I am on duty, so I will come and see you. And if there is anything, I will tell your colleague. Having a full-time system of doctors, this is what we are able to do. The other thing is that we have a very strict antibiotic policy. You cannot use whatever you feel like. And the process that we follow is that for every department we have done prophylactic antibiotics, and there's an antibiotic stewardship program which is going on in the hospital. But if you deviate from there and then there is no reason, then it becomes a incident, and the incident is taken up by the medical director. It's as simple as that. I mean, the first stop is the medical director. He says, how did you break this protocol? And that protocol is extremely rigid, until and unless the microbiologist tells us that it's time to review everything, and we have the hospital infection control committee. The third thing that we do is we have care pathways. And the care pathways is something that is for patient safety, as I mentioned. For example, if you have a knee replacement surgery, there will be a nurse who will be following the patient to ensure all the steps in the care pathway are followed. Now, if one step is missed, the next step cannot take place. And if it cannot take place, for example, the doctor has not signed off on something and the patient is being called to the operation theater, the patient will just not go. The nurse in the ward will just not release the patient. This is because this step in the care pathway has not been followed. And that's it. No matter who it is, that's where it stops, until and unless that pathway is fixed. So therefore, this is another thing which really helps, in the sense is that everybody is tuned to the fact that a particular process will be followed, and that is standardization. So we have this enormous thing about standardization of care, which will come at a particular level. Now, my level, Joy, may be lower than your level, but it will be at that level. I will not have spikes going up where quality of care is very good, and then troughs coming down where the quality of care is very bad. That will never happen. We will come to a standard level of care, and that's what we are known for. And of course, I mean, I ape you in your hospital, whatever the good practices are, I slyly follow all of that. And most of this has been taken from your hospital. So therefore, we hold Hinduja in very high light. But one thing that I want to tell you is also another culture or a standard of practice, which is very good and is standard throughout the United States in their 3 hospitals of the Mayo Clinic. So the Mayo Clinic also has got a very good method of standardization. So some of the things that we have adopted from Mayo, and one of them is this care pathway, which is extremely tight. And that gives us a standard of care where even the hospital's ALOS, that means the average length of stay in the hospital, the infection rate, fluids, the pain management, everything is standardized. So therefore, there's no way that you can get out of this. So therefore, we've been able to ensure that there is a quality of care which is at a particular level. Given a score of 0 to 10, I would say this comes to about 7.5 to 8. Thank you.
Thank you, Dr. Chatterjee. And it is quite heartening to know that you have benchmarked yourself with one of the best healthcare institution, and it is rated as #1 in the US for last several years. And I'm sure when we take some of those, even if you're not able to practice completely, but a modified version of that in Indian environment, in Indian context, it is going to be definitely beneficial for the patients. So Dr. Krishnamurthy is back again. So he was talking about some of the practices and how it can be done in a teaching hospital, and he got disconnected. So I request Dr. Murthy to complete that.
Yeah, so sorry for the problem that happened. So, जैसे कि I was telling कि suppose I have a patient of lab coli who I have admitted for 10,000, and there is in the same cubicle there is another patient, because it's a ward system in a teaching hospital. The private section is different, and I have another patient which is in the poor patient section, and I further discounted everything, and is say in 1,000 rupees has to be done. There is a difference in the attitude of the staff, which is natural, जो होगा ही होगा. I am there to look कि भाई ऐसा ना हो, भाई चाहे ये पेशेंट है चाहे ये पेशेंट है, the attitude has to be same. You cannot say कि भाई इसमें तो हम ये करेंगे, अरे यार उसको दर्द हो रहा चलता है थोड़ी देर. So this attitude has to be looked into, and these are some of the problems. The second problem that we face as specifically a teaching institute, which experience you learn कि your work is to care for the patients. You may not have the same response from all the patients. So you may have patients you have worked very hard upon, but they continue to be rude, and with the I would say जो doctors की image सबने बना रखी है उसके हिसाब से आप लोग करें. So I would take it as a normal thing, but my PG may not take it as a normal thing. वो फिर depressed हो जाएगा, and that उसके चेहरे पे दिखता है, and other patients can also palpate कि देखो ये डॉक्टर आज दुखी हैं. So these are the issues that we have to especially deal when we're dealing with in a teaching hospital. Finance will always remain to be an issue as a charitable organization which is dealing with underprivileged patients. And the important fact to note is finances limitation की वजह से quality cannot be affected. Quality has to be at a basic standard level, and with the COVID issue, the financial wala part थोड़ा और हो गया, because governments are just not paying anything to anyone. They're just committing that we'll pay. Another one more thing that is very important is जो Sujit sir कह रहे थे कि we have a fixed standard for everything, and being a teaching institute, I had emphasized कि किसी भी चीज के लिए a definite level of care guidelines होते हैं, but being a research organization, उसको सही तरीके से उसके ऊपर thesis करना and seeing methods to improve it is also important. Also, it is important to realize that despite being a charitable organization and limitation of funds, timely upgradation of everything has to be done. We cannot be saying that harmonic is too expensive and we cannot have it. So the latest equipment has to be there, because you have to teach the students, because आप यहाँ नहीं पढ़ाएंगे तो बाहर जाके कैसे करेंगे. So there are many things which are related to a teaching institute when it comes to treating of underprivileged patients.
So thank you, and some of the points what you have covered very clearly is affordability should not be a barrier for accessing the quality care.
Absolutely.
Quality care also must be affordable. And third, the options of different clinical clinical processes or adaptation of technology should have easy accessibility for everyone. So these are the three important things what you have told. I know this is very easy for some of us to say that we do that, but at the same time, we know how difficult it is for a teaching hospital, for a hospital where patients are going and seeking free care. And as you have told, 1,500 rupees, you are doing, surgery which we can't even dream about. So you have entirely a different model of, scaling it up, or maybe alternate source of getting funding. And we really acknowledge that the kind of great support and great thing you're doing for the society. So thank you. And I move on to Mr. Devanand. That question is, we spoke in general about the patient experience, engagement and all, but I want to ask, when the entire globally everyone is facing challenge of this pandemic, what are the steps, what are the tools you suggest to improve patient engagement and experience in hospital like ours, like yours, mine, or Dr. Chatterjee? What do you suggest and recommend?
I hope you are asking about the post-pandemic or when during these
No, no,
times.
for the experience during today's pandemic situation.
Okay, see, that's what I mentioned when I, answered the last question. Like one of our unit actually started a program which was called Cosmos. Which is basically the problem with the patients now during the pandemic is that the hospital has to match the requirements of both a COVID and a non-COVID patient. So that becomes the most difficult thing, and it's not only the patient relatives; it's also the staff. The accessibility of the areas, the movement of staff with PP, without PP, all these things gets into difficult situation. And the staff engagement also has been suffering, because otherwise many hospitals used to have a lot of programs. Now it's a festival time, like Dasara has come, Diwali has come, and many hospitals celebrate it with the employees all joining together for the celebration. Nothing of that sort happens. We all restrict people, gathering and celebrating. So what has happened is that the engagement activities for both the employees and the patients have been restricted to a greater extent. But at the same time, COVID is here to stay unless until the vaccine comes out. We have to live with the reality and move on. So what we have understood is that more than the treatment part of it, more of psychological support is what is required for most of the patients. That's what we have seen. See, there was a patient, an old patient, about 76-year-old patient. Both his, one son was in UAE and the daughter was in Chennai. Both couldn't reach Hyderabad for his treatment because obviously the travel and other restrictions were there at that time. But the mother was also pretty old. She was supposed not to remain in the hospital. So they brought the parent here and admitted, but they were constantly in touch with us. So actually, it's not about the care. The family has that concern about this particular patient and whether he'll survive. And I'm happy I still keep his mail as a personal what you say property, or a personal message that he has sent after his father got discharged from here as a valuable gift. And Dr. Chatterjee and Dr. Krishnamurthy, I'm sure they'll have a lot of such experiences of patients party giving good feedbacks. How the patient was taken care. So what we have done is that we have assigned certain people for certain tasks. We have not mixed the duties. So, for example, somebody who connects the patient with the family or the doctor with the family, he is assigned only that task. So he has to move on to all areas and do this thing. And there are people who are designated for that. That gives a lot of comfort for the family because the same person is connecting. They also connect with that person and build a rapport. So it becomes easy for them to speak to them, speak to these staff also freely. That's one thing. Second is that we also have a psychologist on board. He also counsels the patients in case they require family or the patient requires any support. We have been doing that. Now, the other major issue was the cost. Not only the care. Care is one side. Most of the hospitals, as other panelists mentioned, have standard protocols for treatment. Doctors and nurses are all putting all their efforts to give the best care. but cost was also a major deterrent. Many areas where government had stipulated rates we have been following, but some people want rooms, then we have to custom make certain rates to suit their needs. So, which is a big challenge. At the same time, you have to run the hospital, and also people had a feeling that the hospitals were making a lot of money, but instead, actually, a lot of cost escalations also had happened due to the disinfection and the PPE implementation. Also, it was just a fine balance. A balancing act has to be brought in terms of costing also. So, what post-COVID also now, since in this part of the country the COVID numbers are a bit controlled now. So we are now looking at, most of the hospitals are looking at bringing more non-COVID patients who are postponing their elective cases due to COVID and all. So we have to install the confidence in them, not to postpone the major procedures, and we are now trying to bring them back to the hospital and do their procedures by probably giving some kind of incentives in terms of better rates, packages, and things like that. So this is already on. Many Hyderabad hospitals have, I can see that they've already started this. Post-COVID clinics have started, rehabilitation programs. Post-COVID, there are a lot of risk factors seen. So this is something which, as a post-COVID rehabilitation package, many hospitals have started. So healthcare now, post-pandemic, is going to totally change. Many people have enjoyed the teleconsultation module. They have enjoyed the benefits, because they need not have to travel for a small thing. They can sit at home, do a teleconsultation. Lab people will come and take their sample from home. So a lot of options have come in for the patient also to experiment and choose. So I think there is going to be a lot of the tele mode and the home service is going to gain momentum after the pandemic also. So that's something we are also investing more on such services now. As a group, Aster is coming with Aster Labs, and also the Aster Home is already in place. So we are also going to invest on such things to provide more convenience and choice to the patients to make their treatment outcomes better.
Thank you. And we are almost at the fag end of our session, and I'll have one rapid fire round of question. I'll be looking from each of the panelists to give just a minute, message to all the participants, that what is your take as on today, and what do you advise to the viewers and to all of us from your point of view, that how do you improve the patient engagement. But before that, I want to tell you, Mr. Devanand, you told about the kind of patients' appreciation and all you have received. And I don't mind to share this here in this platform about, and I'm very proud of my colleague who is not with Hinduja Hospital, another hospital, who happens to be the CEO. In his hospital, there was a death of a patient who was not known to him. He never met the patient relatives' family, but the patient relatives were in abroad, and the elderly person was admitted in a hospital and passed away. And I'm very proud to say that at that time of condition, he didn't hesitate, and he has gone and done the last ritual for the deceased. And that is a kind of commitment, or you call empathy, or the kind of support has been shown. It is really a big example in front of all of us. So with this, I move on to Dr. Sujit Chatterjee for the 1 minute wrap up session. You're mute.
Well, I think 1 minute wrap up session is good. Joy, it's been a very enlightening sort of interaction. Healthcare is going to be very important for all of us, and we all know it. Health is going to be the new paradigm, as well as the new cool, so to say, for everybody in India. And I think slowly the government is definitely going to change and become more focused on health. I do hope to see that there is going to be an additional amount from the GDP devoted to health, because COVID really would have taught us a lesson. And COVID is just not one. There may be other things. The respect to the healthcare community, I am sure, is going to increase post-COVID. This is something that we have actually fought a battle and a war, and we are now surmounting that, and we are keeping our nation well protected and healthy so that we can march on in this decade to a new future. Thank you very much.
Over to Dr. Krishnamurthy.
Sir, I think more than improving the healthcare, we need to focus on the projection media improving the false image of doctors and the hospitals that has been created. It is not a very bad situation जितना लोगों ने उसको दिखा रखा है. ताली एक हाथ से नहीं बजती, दो हाथ से बजती है. Healthcare is a two-sided thing, and जहाँ पे hospitals and doctors should improve, the media, the Bollywood, any sort of people who are making the mindset of the people should realize कि doctors, judiciary and teaching, guru, doctor और judge, इन तीनों की image खराब नहीं होनी चाहिए, which they have managed to do. So more than the healthcare, we 50% healthcare improve करे, 50% ये image change होनी बहुत जरूरी है. I think that should be the summary of healthcare today in India at least.
Over to Mr. Devanand.
Yeah, I think I've already, went through most of the points. So the only thing that recently I was part of another panel discussion. I was not a panelist. I was just an audience, listening to the other panelists. The topic itself was mentioning, the topic name itself was very interesting. Have we lost the soul of medicine? Soul of medicine. That was the topic. So, many people mentioned that, there are instances where the patient feel that doctor is not giving the personal attention to the patient. Most of the time, they are the computers, typing their documentations, because most of the accredited agencies also want the documentations to be done. So that personal attention, personal care, more in affection towards the patient and the relatives, that probably that devotion of time from starting from the consultation to their discharge time, that personal attention is lost. Most of the time, many other healthcare workers also, are focusing on many other tasks, but the major task is care and compassion. That's what patients and relatives expect from a hospital, which I think should be given more focus to bring back the whatever Dr. Krishnamurthy was also saying, the lost glory, or that we are losing now. To bring that back, I think more focus should be given on the compassion as well as the care part. Obviously, I think we will be able to regain the confidence of the patients and survive any challenging times. Yeah.
Thank you. And before I end, I want to tell you that last year, a business house, prominent business house, they came out with a report where there was a survey amongst the patients across the country from different cities. And that survey truthfully projected, or rather portrayed, a feeling of our patients. And we have seen the kind of trust they have on their providers, the trust they hold on the professionals like doctors, nurses, and the kind of mistrust they have on the entire system. So if some people have not agreed, some people have said it is exaggerated. So even if it is exaggerated, and I take it with a pinch of salt that it has not been portrayed properly, but still I feel we cannot completely ignore that voice of customer. It is the true voice of customer. We have to take it in a true sense and with true spirit, and we need to work towards a system when after 5 years, if we come out with the same report, we see a complete different picture. We get back the confidence, as Dr. Krishnamurthy mentioned, एक हाथ में ताली नहीं बजता है, correct? So for that, what we need to have our trust back. We need to have the confidence back. And all these are possible when we have systems like care management, patient engagement, and attempt to give them a better patient experience while they are in our facility. So let us work together. Let us see how we can change this. So with this, I want to thank all my fellow panelists for sharing some of the best practices and sharing their views and making this session very interesting one. Once again, I want to thank the organizers for giving me this opportunity to moderate this session. So with this, I want to thank and conclude this session. Over to Mr. Sudhir.
Thank you very much uh, to all the esteemed panelists, and a special thanks to Mr. Joy Chakraborty, who's the COO of PD Hinduja Hospital. It has been a very interesting session, of course. The most important thing that always comes forward, that is the patient care, improving the patient care. We've seen the panelists talking about the compassion, and it is very heartening to hear from them and listen to them about the patient experience. This has been amazing. So this is the day 2 and the fourth session, which focused on the care management best practices. So we would like to thank our moderator of the session once again, Mr. Joy Chakraborty, and our esteemed speakers, Dr. Sujit Chatterjee, who's the CEO of Dr. L.H. Hiranandani Hospital. And thank you very much for joining us, Dr. Sujit. And also, thank you very much, Mr. Devanand, K.T. Devanand, CEO from the Aster Prime Hospital. And also Dr. Krishnamurthy, who is the Deputy Medical Superintendent and also Trustee Secretary for Chhatrapati Shivaji Shubharti Hospital. Thank you very much, all of you, for joining us and making this session very enriching. We have been live streamed through Facebook and also YouTube, and soon these interesting session will also be available for us after this session, and we'll also be coming up with a conference report of this, which will be released in our upcoming events. Thank you very much, everyone, for joining us.
Thank you all.